Hi, I'm Dr. Philip Borgardt, and I'd like to take a minute to talk to you about hormones. So let's start off with, what is a hormone and how does it work? Well, hormones are your body's main means of communication. Nerves are very fast, but they only go a few places. Hormones can talk to every cell in the body. And this isn't random, it's run by the brain, and the brain has a little communication bundle that comes off the bottom called a pituitary stalk, and it sends signals down to the pituitary, which is one of the master glands in the body. And like any other gland, when it gets a signal to do something, it just dumps hormones into the bloodstream and then randomly bathes every cell in the body with that hormone, relying on the fact that only a cell with a specific receptor on the surface is going to respond. So that hormone floats along, and when it lands on that receptor, it binds, and then deep inside of the cell, it's like flipping a switch on an assembly line, and that cell does whatever it was pre-programmed to do. Well, as we get older, both men and women begin to lose our hormone levels. And those cells with their receptors just sit there, ready, willing, and able to do their job, and they're not going to do anything until they get a signal. So this leads us to hormone replacement therapy. Old-fashioned hormone replacement therapy used chemicals instead of hormones to stimulate those receptors. These drugs have problems. That's where we got the increased incidence of breast cancer, heart attacks, and strokes. When you use real estradiol, progesterone, and testosterone topically, multiple clinical trials have shown no increased incidence of heart attacks, strokes, or breast cancer. So at my office, we only use the real estradiol, progesterone, and testosterone. So around age 40 in women, their hormone levels start to drop. That's when you begin to have sleep problems, difficulty concentrating, mood swings, and that dreaded brain fog of menopause. It's not till you get closer to 50 that you start seeing irregularities in the menstrual cycle, night sweats, hot flashes, vaginal dryness, and atrophy. Now, these symptoms are all easily treated with a topical cream simply applied twice a day. There are also other long-term benefits. Women who use hormone replacement therapy live longer. They get less dementia, 30% less osteoporosis fractures, and you get to maintain your female anatomy lifelong. When you want to get your youthful body back and treat these symptoms, please give us a call. This is safe, effective, and easy to correct.